So what is naturopathic medicine? We have six tenets that we go by for naturopathic medicine. For what it's worth, there are 8 colleges and universities across the United States and Canada that teach naturopathic medicine, and we all pretty much follow these 6 ideals of using the healing power of nature, identifying and treating the root cause, doing no harm. Doctor as teacher is a huge one because it's so much of naturopathic medicine is about teaching somebody how to take care of themselves and not just being somebody that you go to get a prescription or a pill and do what they say. So it's a give and take relationship with a lot of education involved. We treat the whole person, obviously, and then a lot of what we do is actually prevention, which is totally outside the scope, I feel, of conventional medicine. All right, what is our therapeutic order? It is a stepwise process of starting at the least invasive and going to the most invasive, so that as we look at complex illness, we address it in ways that are very gentle as much as possible, only going up to the next level as needed. It's very simple and straightforward, removing the obstacles to cure. For example, if somebody is smoking is an obstacle to cure if somebody has lung disease and heart disease. So you can do lots of things, but until you remove that obstacle, it's going to be tough for somebody to really heal at a root level. We want to stimulate the self-healing mechanisms that are in the human body. Like you get a cut and you put a Band-Aid on it, and a week or 2 later, it's healed. And the reason it's healed is because there is a self-healing mechanism. The body is designed to heal itself. And that includes psychologically and spiritually. If we can do that, it helps everything work better. We want to strengthen weakened systems. We understand that the way we live in modern society creates deficits. Part of what the body needs to heal is strengthening those weakened systems so they can take care of themselves. Correcting structural integrity is what a lot of providers do, massage therapists, chiropractors, DOs, folks who do craniosacral. The structural integrity is so important from a Chinese medicine perspective, for example, of how well does your chi move? And can you do yoga with a bent spine? You can, but move as well. If we can help correct the structural integrity, everything works better. Using natural substances and then using pharmacological substances as needed. And then when it's necessary, using high force interventions is needed to preserve life. So for example, when Jim talked about his near-death experience, took 6 days in the ICU, nobody wants a naturopath in the emergency room. Sometimes those things are needed. I've ended up in the emergency room myself, and I used naturopathic and Chinese medicine to heal me, but I might not have been around if it weren't for the very timely application of higher force interventions in the conventional medical system. So what is naturopathic medicine? I think the goal from our perspective is more than just change. It's about transformation. And a lot of the providers that you're hearing from today are probably talking about transformation. So what's the difference? I think change can be looked at as something that's tactical or linear. If you are following Decent Med and the types of providers that we have, you're not going for short-term relief. You are looking for something that is going to transform the way that you do business. Real deep change or transformation, that's got to be something that's done on a structural level, a foundational level. Shifting that identity, like Jim talked about, how did the belief patterns that we have form how we interact with the world at large? And this requires reorganizing the nervous system and the internal landscape of what's going on. Once you shift this, change the nervous system, you change your physiology. And if you change your physiology, and physiology not just in terms of neurotransmitters and serotonin or dopamine, but also things like cortisol and adrenaline, that completely changes your baseline for health, safety, and defines what's new in terms of a new possibility. The cool thing about transformation is it's not easily undone. Eckhart Tolle says it really well when he says, once you wake up, you can't go back to sleep. And I think that's very true about some of this deep transformation that happens when you work with a provider like a Chinese medical practitioner or naturopath or a doctor of osteopathy or a hypnotherapist for that matter. the system can't return to the old order. It's been completely transformed with a new paradigm on a very, very foundational structural level. And from there, the behaviors change organically. This is something obviously that can take time, but that's the beauty of a relationship with a naturopathic doctor. One of the things I noticed that when I moved to my current town of Port Townsend, Washington, one of the naturopaths had just passed away, and I ended up inheriting some of her patients. And they indicated that they had long-term relationships with this doctor, and they were looking to establish the same with me. And that's an indication that they acknowledge an ongoing relationship with somebody over time is really, really important. And all of this aligns with the naturopathic goal of treating the root cause and supporting the whole person, because this cannot be done without treating the belief patterns, the identities, the psychology, the physiology, and then the scaffolding structure of the muscles and the bones, the ligaments, and the fascia. Key distinctions: change doing differently, transformation being different. There's something that's, you're just being in the world differently. Change modifies symptoms and needs willpower. Transformation creates momentum and discipline involved, but because the structure and the paradigm are different, it feels less like work and more like, this is who I am now. All right, so how does that align with the naturopathic principles? Well, first, do no harm. Deep healing only happens at a pace that the body can integrate. I've seen a lot of people who go through deep, deep transformation with psilocybin and iboga and bufo and MDMA. But if it's so much that their body can't handle it, it's not going to be a therapeutic tool. So these things need to be metered appropriately, and you need to be supported in a safe space and a safe pace in order for that transformation to unfold. We can do a lot of harm if we do too much too soon in a place where people are not adequately supported. Using the healing power of nature, I think transformation helps remove obstacles so the body's innate healing fully activates. This is not an external in. This is not, although we do use botanical medicine, this is not a drug that we push on the body. We remove the obstacles so that it's like planting a seed appropriately and giving it the nutrients and the water it needs so that the seed transforms into a shoot, and then that just happens innately. Identifying and treating the cause change. Maybe you're addressing symptoms. I have high blood pressure, therefore I will either add Rauwolfia, which is an herb, or we will add lisinopril. But true transformation gets to the root. What's causing your high blood pressure? Is it the narrowing of your kidney arteries? Is it psychological? You're under stress. So working with a naturopath helps create the transformation for even basic physiological things. Treating the whole person, transformation, change, you might address individual pieces. And that's the way our conventional medical system is set up. You have a cardiologist, you have a pulmonologist, you have a nephrologist. But in reality, our nephrologists should probably be talking to our cardiologists. Yes. Our neurologists should probably be talking to our psychologists. That you can't take these things apart and create transformation. You've got to reorganize how you're looking at the entire system in order to create that lasting transformation. All right, one more comment. Thank you, Amara. She says that part. Doctor as teacher. I can't say enough that education is one of the biggest things that I feel like I give to my patients. It's the whole biblical adage of give a man to fish and he eats for a day, teach a man to fish and he eats for life. And this is really important because not only does it give the patient tools to take care of themselves, but it builds a self-understanding and agency. Like in a world where we have no control and we feel like we're being manipulated all the time and being told what to do, having the ability to, to have some agency and control in your life over your body is really, really important. Mm-hmm. And then creating that transformation by establishing an organism, your body, both psychological and physiological, that prevents disease naturally. Now, we all know that this isn't 100%. Like, I have a cold today. That happened. but I have a lot of tools in my toolkit that will help me heal from that and come back out on the other side just as good as I was when I started. Yeah, yeah. Amara says there's not a lot of agency because of big pharma, and I have to agree with that. There's more that needs to be done. So what makes NDs unique in an area where, things like functional medicine are taking hold? So many naturopathic doctors bring more than one thing to the table. I bring 5-element. I bring Chinese constitutional patterns. I bring a TCM organ system. I bring vitalism. And even if somebody doesn't have an Ayurvedic, even if somebody doesn't have like an acupuncture license, they're still bringing that vitalism. But what these things do is they give us ways to see patterns that are a different paradigm and a different language to help people learn how to take care of themselves. In a lot of ways, it allows us to see patterns before they emerge. Naturopathic doctors, along with folks like DOs, also bring things to the table like hands-on therapy. Dr. Bastyr, who the Bastyr University in Seattle, the school that I went to, was named after Dr. Bastyr. One of his adages was, "You touch every patient." And I think in that way, maybe physical, a lot of people do have a lot of issues with physical touch. Trauma is a real thing. And in order to be a good provider, I think being trauma informed and understanding where that layer of safety is for the patient. But if we have the ability, touching people is a great way to co-regulate two nervous systems. Somebody comes in and they have anxiety. Touching them helps regulate their nervous system. And that's very easy to do through naturopathic manipulative therapy, which is basically like chiropractic adjustments, right? Visceral manipulation, craniosacral. I do fascial counterstrain and myofascial release. That is done with the clothes on, even their socks on, and it's non-invasive. And anything that they say, if they don't want me to touch their abdomen, we don't touch their abdomen. But it allows me to address their pain, psychological and emotional, in a way that allows for safe touch and reorganization of the nervous system in a safe container with one person so that they can learn that, okay, this is what it looks like. And then they can take that as part of the education, take that with them out into the world and see where they can recreate that with other people in their lives. Oops, there we go. Botanical medicine. I think one of the things that naturopaths bring to the table that a lot of functional medicine don't is botanical medicine, like herbs as medicine, not just a supplement. Like, what is that herb specifically doing for you physiologically and energetically? And it's a deep, deep foundation of what naturopaths do. We get so much nutritional medicine, so much botanical medicine that by the time you're done, you not only understand the herbs themselves, but you understand how they work together. You understand that herbs like licorice and sage don't just do things, they actually help synergize a team of herbs and how to put those things together. That's way beyond just doing a supplement of ashwagandha. Mm-hmm. That's creating an herbal team for somebody that creates an energetic medicine, a physiological medicine that aligns with who they are constitutionally and supports the system. Oh, excellent. Amara comments that she graduated MS doctorate in acupuncture in 20. Oh, you are graduating. Oh, fantastic. Good luck. And I wish you all the best. We need more people like you for sure. Mm-hmm. All right. Bottom line, NDs prescribe, and this goes for Chinese and Ayurvedic herbalists as well. We prescribe as medicine and not just as drugs.